when you look at the average Australian person who earns 40,000 a month, that's the average income for anyone in the community. So we're talking, that's the average.
Like 7 to 8 times more than?
Yeah, absolutely. So, doctors are obviously in the upper class of the society. I mean, cars are cheaper. They find out which one works for you and, follow your dreams.
Dr. Rex told the actual, inside facts and the demand supply and the salaries and everything he has explained. So we discussed all these aspects now. Hello, this is Dr. Dheeraj Masapu. I'm a consultant neuroanesthesiologist, and today we have Dr. Rex Prabhu, who is the Executive Medical Director in Swan Hill Hospital in Victoria, Australia. So today he has come into our channel to help us understand what are the different pathways to reach Australia as a doctor from different specialities. Welcome to our channel, Dr. Rex Prabhu.
Thank you so much. Thank you for having me and, communicating over the last few months. We've finally made it.
It took a long time.
Yeah, absolutely. Yeah.
So most of my subscribers are doctors, and most of them are MD, MS pass outs in India. So many of them are interested to come to Australia. So how can you help them, and what are the different easy ways to reach Australia?
Sure. There's lots of pathways. I think my own journey after completing MBBS in India and then moving to Australia in finished my MBBS in 2011, migrated to Australia in 2012, and then subsequently working in pediatrics, working in general medicine, and then finding my final calling in specialist medical administration. That's where I fellowed as a fellow of the College of Royal Australasian College of Medical Administrators, and have been in executive medical roles from 2019. Started as the Deputy Director of Manly and Mona Vale Hospitals in Sydney, which are large-sized district hospitals within Sydney, and then moved on to Westmead, which, Westmead is a very famous hospital in Australia. It's a quaternary care centre, more than 1,000 beds. I was the clinical superintendent there. And then from that position, I moved on to Swan Hill, where I'm currently been working for the last 4.5 years as the Executive Medical Director. It's been a journey, and so I've seen the journey from moving to Australia to now, being on interviews for doctors that come into the country, selection of candidates, what really matters on how you present yourself. And obviously there's various different pathways at different stages of your life, whether you are an undergraduate, whether you're a postgraduate, or whether you are completing your super specialist training. There's lots of opportunities as long as you've got someone to guide you, because I think that's the key factor, because it can be very confusing when you just open the website and say, oh, I have to do this and follow this, but you really need having someone on the ground who's gone through the process, and then, obviously mentoring you through the different stages from time to time. I think that is what I can offer.
So can you briefly tell us, what are the different ways we'll just categorize into two categories. One is a post-MD or MS pass out with 5 years experience.
Yeah.
Another is a senior doctor with 15 years experience.
Yeah, sure.
So for both of them, what are the best ways to reach?
So somebody who's finished MD and or DM and 5 years, I think they are in the right stage to actually migrate to the country, because they are on the younger side of the workforce, and moving to another country is uncomfortable. The earlier move, I think adjusting is easier when you're young, and as well as I think with that experience, most often in specialist assessments, as long as the candidates are able to communicate well about their training, are able to put that in paper, Australian systems are quite comparable to the level of training that they get. So if somebody's done MD plus 5 years experience, although Australian training is usually 6 years postgraduate training, but in some way it can be found partially comparable or fully comparable depending on the college assessment. Every case is different, but there are some rules to how you put yourself together, compare the Australian curriculum to the training that you've had here. And I've seen candidates who've done really well with no exams, but having 1 or 2 years of peer review or 1 year top-up training as a senior registrar there, then a year of peer review. So there are some real good success stories to people who've been guided and mentored through the process. So I think it's a great opportunity. I think post-COVID, Australia's workforce is really the demographics and the work culture has shifted. People want to do more meaningful work. They don't want to spend more hours, but they want to have quality time at work. So we're requiring more numbers of workforce to make up for the services that we have, and our services are growing. They are not stopping to grow. So there's lots of opportunities. Yeah.
So basically, what you were telling me before is a kind of work-life balance and a good salary is what Australia offers.
Absolutely. I think the labor laws are quite strong in Australia. So working 40 hours is considered, towards maximum. Some people might put in another shift a fortnight, but I don't see people putting copious amounts of hours. So you have a good, generous pay package, benefits. Working in the public system, you do get access to other benefits like salary packaging, where you can, put it towards some technology, put it towards a car. And in the public sector, specialists do get access to, 5 weeks of annual leave, 2 weeks of professional development leave. And plus some money towards conferences and those aspects. So I think overall, the lifestyle is much more different than what it is here. And when I come back often, I ask my colleagues how many hours you're working, and, they're putting in copious amounts of hours. There are times where they have clinics till 10 o'clock. They don't have time to go to their families and children. And they obviously reflect on it. But it's difficult because they have to keep up to a lifestyle. They want to educate their children. They want the best outcome for them. Fees have to be paid. So it just becomes a cycle that they can't get out of. Yeah. And then obviously later in life comes the regrets.
I'm getting tempted to go to Australia after that. So then in my channel, there is one more interview with the consultant anesthetist.
Sure.
Yeah. So he briefly explained in that interview, I'll keep that also in the description. So he explained about the working days and the pattern of work for anesthetists. For other specialties like surgeons, many people are watching the interviews.
Yeah.
Many orthopedicians and many dermatologists are actually messaging me directly.
Yeah.
So what is the pathway we should go, and how should we go about? Where to start with, and where? Briefly, if you can.
I'll give you an example. I'll start with anesthetics because I'm well versed with if you're a full-time staff specialist in anesthesia, general anesthesia in a public hospital, the workload for them is 6 sessions. We classify sessions as 4 hours of work. Okay, so 6 sessions, usually 3 days they'll be anesthetizing, so 8 hours, maximum of 8 hours, right? And then there might be some days where if you're you might be on call once or twice a week, because there's an on-call to be done. But again, in bigger hospitals, you've got a registrar on call, your second on call, and those aspects. So the bigger the hospital goes, the supports increase. I guess if you're in a regional setting, 2 days a week is considerable, reasonable on call, and you might be called in for emergencies and things like that. It might take another hour or so. And usually one day will be pre-anesthetics of a week, and then the last day, 5th day, is usually non-clinical time offered to specialists, where they can spend their time in teaching students, they can spend their time in education, research, clinical governance activities in the hospital, including, looking at case reviews, mortality, morbidity review. So in that whole aspect of work, there is so much of difference in everyday's work. It's not just, pump out the lists.
Yeah, anesthesia, I think in detail,
Yeah, correct. Yeah. And so general surgery, for example, the surgeons that I work with in Swan Hill, now Swan Hill's a 145-bed regional hospital 3 hours away from Melbourne. The difference is we are a fully integrated service. So, the portfolios of community health, general practice, as well as public health comes under my portfolio. But in a general surgeon's lifestyle, they'll probably be doing, again, 3 operative lists a week.
Okay.
And again, two sessions a day. And then post-op rounds in the morning on the next day, and then going to outpatient clinics.
Okay.
And depending, so the 3 surgeons in Swan Hill, they work on a 1-week on-call roster. So they're on call for a week, and then there's another one's on call. So they split it how they want.
Yeah, I got it.
Kind of thing, but the organization has a responsibility of no further on call than that. So when they go on leave, we kind of cover with visiting surgeons and things like that. So they're assured of their, time off when they want that. Yeah. But in bigger centers, obviously, where there is subspecialty work, again, I don't think the workload will be more heavier than that. So there is obviously that the work that comes out is, I think, more productive, because when you're focused and you're planning well, your outcomes are much better. Yeah.
Okay, got it. So then we'll get into the interesting part of the video, like salaries.
Sure.
I did some research, and I already I spoke to the previous anesthesia. He also mentioned a little about the salaries. So around 150 to range of 400,000 Australian dollars is what he told.
Yeah.
And that the range of how was it decided and how does it improve?
Okay, so we've got in the public sector, we've got enterprise bargaining awards. So the unions, the doctors' unions, they go with the governments, the state governments. Each state has its own government that they negotiate with. That happens every 5 years. We call it enterprise bargaining award. Okay. Now everyone's paid at the grade of their experience, and each state is different. Okay. So, as you said, it's a range, and it can range from 250,000 in some states to nearly 500,000 in other states. But there's few other differences, like some states will have more leave packaged with it, some will have a bit less, some will have continuing medical education allowance paid pre-tax or post-tax. There's a few nuances to it. So, but you're roughly assured that, as an anesthetist, if you're doing the basic minimal work, the minimum without any overtime, you're surely assured of 300 to 350,000 kind of package. Okay. Wherever you are, once you kind of work for the whole year. So it is quite, when you look at the average Australian person who earns 40,000 a month, that's the average income for anyone in the community. Oh, so we're talking, that's the average.
Like 7 to 8 times more than?
Yeah, absolutely. So, doctors are obviously in the upper class of the society from when you talk about salaries, and even if you look at the tax, Australian tax office's list of personnel who own the highest salaries, it's filled with doctors first, and then other trades as an individual salary. I'm not talking about business and startup. That's, obviously corporate stuff is completely different and things like that. Yeah.
So you don't know the cost of, big cars, Mercedes and all. I think with 2-3 months salary, you can buy a big car.
Cars are cheaper in Australia. I was just talking to a colleague here that, probably the tax is 50. Luxury cars are taxed heavily here in Australia. So I think if you buy a BMW or Mercedes in Australia, it's probably half the price of what you pay here.
Oh.
So, we do have luxury car tax, but
lesser than,
cars are cheaper there, including shoes. Branded shoes are cheaper in Australia.
Okay.
We also considered the iPhone. Recently, one of my colleagues said, how much is the iPhone? And we did a price thing. It was 75,000 rupees when we converted. And here it was 149,000, isn't it?
It's almost double.
Yeah. So a few things, goods and services, I think. But then there are, for example, eating out is expensive in Australia. Going out to the movies is expensive to Australia. So there's other aspects to your day-to-day lifestyle. That's it's different. It's a different economy, different.
If somebody doesn't get 40,000 Australian dollars.
Yeah.
After getting 300, 350, you should be having a luxurious.
Yeah, I think reasonable, as long as your desires are not, owning the best and best. And what does one need? You need a house to go to sleep, a good house, a car, education for your children.
Education for children, is that free or what is that?
Yeah, so Australians' public health education system is completely free. So anybody can study from first standard to medicine It's all subsidized by the government. There's no fees till year 12.
Okay.
And even once you get into professional degrees, we do have what is called as HEX, which is fee assistance. It's a student loan that is given to, prospective students. They can pay it off after they intern and things like that. So it doesn't really, it's not the pressures like here. It's definitely not the pressures like here. Yeah.
So then which specialities, if you consider, just name the specialities for you, like medicine, surgery, there is radiology, anesthesia, and pediatrics, and there is, well, the good ones are. So among these, who will have the best chances of getting into Australia? What is in demand there?
Yeah, I think in terms of Australia's needs right now, general practice is big. It's the biggest requirement at the moment. And after general practice, I would think...
general practice is like general medicine, family medicine?
So general practice is a little bit different in Australia. So general practice is a subspecialty on its own in Australia. It's a 4-year postgraduate degree with a fellowship. So unlike here in India, you finished your MBBS, you've interned, and you practice as a general practitioner. There it's considered as subspecialty itself. They have to do 2 years in the hospital and then 2 years in general practice training, where they get the entire gamut of chronic disease management. So for example, if you're managing somebody's, complicated diabetes, say, the general practitioner in Australia is quite good, who can deal with these things and then refer on to the specialist. He is the gatekeeper for everything in Australia, so he or she. So it's a very different landscape compared to India. And second, I would say we've had the Royal Commission into mental health last year. So there's obviously, mental health services have got funded significantly and will get funded significantly. And there's increasing need for mental health needs. So psychiatry is up there. Your medical specialties, obviously, pediatrics, obstetrics and gynecology. I guess regional places that are, there's a quite diversity of breadth and depth. General surgery as well, orthopedics in a few, ENTs in some really regional remote places of requirement, ophthalmology. Look, I wouldn't say any or wrong. Radiology also, I've seen candidates who come, from India, spend time in the Gulf, then move to Australia. Everything, on specialties are of good importance. Yeah.
What about super specialists like oncologists, radiation oncologists, and cardiologists, and those specialties?
Yeah, as I was talking to a few of my colleagues now, there's quite a few new services. As the service requirement is growing, new hospitals are coming through, and now they've got to start super specialty services. So we're not producing enough numbers required for meeting the service needs. And the first point are, developing countries like India, where the skill set is there.
Yeah.
And often if you've seen smaller places like Adelaide and things like that, cardiothoracic surgeons have actually migrated in the 90s, set up services there, and they continue to support fellowships and things like that. And I was just at CMC, Christian Medical College, Vellore, and speaking to their staff there, somebody migrated to Adelaide 10 years ago, and then everyone follows them.
Yeah.
Through. Yeah.
The whole town goes there.
Yeah.
Either Vellore will be there in Adelaide.
But they do say that some of them have actually just trained there and come back and brought their training experiences, and actually have standardized systems in Vellore, which, I was interesting to see. They follow our Australian triage systems in the emergency department. They follow our, antibiotic guidelines in their aspects of training. I saw they've written a book, Vellore Handbook of Emergency Medicine, which is based on the Australian guidelines, resuscitate guidelines. So it's also that some of them want to come back, so they're going to learn systems and come back, and they have. But, some of them choose, once they get exposed to the lifestyle, they make that choice for themselves. Yeah.
Usually it is very tough to come back once you get used to different lifestyle.
Yeah, I think, I wouldn't imagine moving to, I was talking to my classmate the other day about leadership here in India. Usually you have a director who's retired or semi-retired becoming the head of institute and things like that. Whereas in Australia, leadership training is medical administration is calling for youngsters to come in as their first career. And if you look at the tech world, you've got youngsters and CEOs of all top tech companies. So why can't we have youngsters in management have that fresh kind of energy into improving systems and processes? So, I'm thankful that I made that call early, and thankful for the career that I have, and thankful for the choices that I made.
Very nice. Even I was thinking I would pursue the management career before, but I've gone too niche into neuro anesthesia.
Yeah, sure.
Like now it is very tough to actually. Now I set up my brand in that.
Correct. Yeah, I know you're in a subspecialty, real core stuff. So keep on to that, because we do need people on the floor.
Because some actually the 5-6 days should be trained in that way.
Absolutely.
Help people.
But there's also leadership training. Like even as a neuroanesthetist, you can, we are thinking of establishing some kind of leadership programs, about clinical governance, communication, how to handle a difficult patient, medical legal stuff, how to say the right things. Patients want, just like, the patients are of the Western, technology has changed everything. The same patient code that you see in Australia, you probably see here now. They've got choices. They can go to you and they'll say, that doctor has told me this. So it's about being consistent. It's about providing that care, those aspects. And that's what we can definitely exchange. Yeah.
Icing on the cake is required.
Absolutely. Yeah.
I can understand. So that is where we are lacking behind. But I think now the newer hospitals, which are located in metros, are training students in that way. But it's not happening in 99% of places. That is where we are lacking. Hard skills are good, but soft skills is where we are lacking.
And I think the difference is my wife, is born and brought up in Australia. She's a doctor herself. What I learned was, as a MBBS graduate here, and when I went to Australia, I interviewed for the first time. Whereas for her, she had an interview before getting into medical school. At every stage, at internship, she had an interview. When she became a resident, she had an interview. So, that interview practice, those skills, those scenarios and all of that, they are much more polished, because at every stage of their career, they have to go through an interview. And even selection into specialist training in Australia, yes, there are components that you have to gather. For example, to get into surgical training, they need some points. They need to do their general surgical exam. Some need to do some research. They get points for each of them.
Competency-based training.
Correct. And then, but the final yard is that gets you to the interview.
Yeah.
Now, in the interview, if you've not performed, you probably have not polished yourself enough to get the position. So these are the skills that you actually require, because if you're working in a competitive merit-based selection environment. So,
interview is you need a separate training for that, I think.
Yeah, absolutely. So practicing, they say when you're under stress, you don't excel in performance. You come to the level of your practice.
Correct.
And so having mock interviews, preparing with some people, going through scenarios, because you end up having 40 to 50 questions. Those questions don't change. The way they word it might change, but it's all practicable, it's repeatable. And it's also demonstrating the person's individuality, selling their character, because at the end of the day, somebody's looking to appoint a trainee. They want to know whether the trainee will be a good fit to the team.
Got it.
Will the trainee be successful? That's what they're looking for. Will the trainee have... Obviously, being safe is important, but also, are they going to lead to success in their career? Because we are there to obviously select them towards success.
Yes. You're going from safety to success now.
Correct. Yeah.
Got it. So now we'll come to the final part of the interview. So how can you help my subscribers? So after saying this video, many would be interested to. They'll comment, put a lot of comments in the comment section. They have my phone number, and so they'll be calling me.
Yeah, sure.
So how can you help them, and how many can you help? What is the...
I think don't bombard me with too much. Maybe go through you. Obviously,
we can filter
and see. Moving to another country is really uncomfortable.
Yeah.
you're really comfortable in your zone here. It's moving your life, moving your family. I always say, don't just talk to yourself, talk to your family, talk to your partner.
Got it.
Make that decision because it's moving with your children and those aspects. And once you've made that decision and you want to pursue it, then I'm happy to have a conversation one-on-one to say where you're at. And also obviously guide you towards, there are some experts right now who are helping people with their paperwork, with their, interview coaching, specialist exam. So I can, lead them to the right pathway. And obviously, I've been in touch with a few candidates now, probably 6 or 7 who've come through various channels, sources, say, I'm applying for this. I don't know, it's a new country. What do I do? Happy to have a phone conversation. Yeah.
So this MCHs and DMs who have done in premium institutes in India, so will they have any kind of advantage? Because premium institute in India is considered like very tough to enter, beat the competition, and are they getting any advantage? What is European?
I don't think there is any distinguished advantage of being in a premier institute, because at the end of the day, there's a job and there is a person. The process of interview then goes through, sees whether the skills is the right for that person. And obviously it then results with referee checks and then a job offer. So it doesn't really matter where you've graduated. I graduated from AJ Institute of Medical Sciences, affiliated with Rajiv Gandhi University in Bangalore. And I've had one of my junior as well move to Australia, become a GP. So there's, it doesn't really matter from where you're from, as long as you're able to either in the undergraduate pathway pass the exams or go through the specialist assessment.
Got it. So then I think we have discussed almost most of the aspects. Anything else you would like to add to the things that we already discussed?
I think, you have to kind of choose in this day and age, whether you want to continue to live a life and then think of options and opportunities. And not only Australia, right now the world's opening up. UK, a lot of my colleagues who, done their degrees now, they are planning to go to the UK because doors have opened up post-COVID. I had another classmate of mine who's a cardiothoracic surgeon who's completed his USMLE waiting to get a match in the US. So everyone's trying different avenues and pathways. So, find out which one works for you and, follow your dreams.
Right. Thank you. So thank you, Dr. Rex Prabhu, and thank you for your valuable, precious time. And I hope some of my subscribers will get benefited from this discussion. And I think you have to watch 2 more interviews in the channel where we discussed with 2 more consultants. One is a plastic surgeon, another is an anesthesiologist who are working in Australia. They also actually dissected and told about many aspects. And as a managerial position, Dr. Rex told the actual inside facts and the demand, supply, and the salaries and everything he has explained. So we've discussed all these aspects now. So then if you're okay, so thank you guys.
Yeah, thank you.
Thank you.